Sorry I missed you guys last week, and I'm back, and it's starting off the fall season. I know it's not quite fall yet, but it feels like it around here in upstate New York. I hope everyone's doing well. Mindfulness each and every day, and give me 1 second to get locked in on our Facebook. And we got Facebook and Instagram. We had challenges a couple of weeks ago, and then we took Labor Day weekend off. And I'm contemplating Monday nights, and I'm gonna maybe put out an offer there to see how many are thumbs up to Monday nights or prefer Sunday nights. And both work, but I'm thinking maybe a little shift and change. Really have a lot of things coming today. I'm going to be really looking at the questions and our team, both our CMI Fertility support team, all of you out there, and the CMI Fertility global team is going to be out there helping answer questions for everyone. I'm sure everyone can hear me well. Let's see, Kylie Lee, how you doing? Valerie Lynn, hello. McGean77, Alicia McKenna, Christina Copley, Brandon Graham. Again, love to everyone. I hope everyone had a fantastic summertime. And we're getting into the fall season. Remember, upstate New York, it might snow from time to time, but it's always open, by the way. And we're working again on our Montreal, our Atlanta monitoring, and I'm working on down in Queens or somewhere local to get some more monitoring. But remember, your OBGYNs can help. We're holding the pricing, $3,900 IVF. We're keeping everything affordable, quality access, and payment plans. So again, we're gonna keep on focusing on inflammation, reproductive immunology, dietary shifts and changes. You know my craziness on keto and Maria's stuff. And don't forget to check out Maria Emmerich's stuff on her keto. And I will probably die with this one on keto. I'm never stopping until I'm in the grave. And hoping a long time on that. Daniela, how you doing? Teresa from Pittsburgh. Hello. Pittsburgh, TX, Texas? Okay. Let's see. A money back guarantee that is going on. All right. Will and my financial team can really get you the details. I don't want to throw my misspeaks on that one, but we have a lot of stuff coming in on really working on the money back guarantee programs. We're still going to be giving away our IVFs. I'm working on more lower dose mini protocols where we're doing a letrozole 5 to 10 for 5 days with a 150 of either Gonal, Menopur, or Follistim with about 20 of HCG from day 2 of the cycle. Even where we're reducing the number of monitoring visits to ultrasounds, maybe on day 5 or 6, minimal blood testing in order to get people moving forward. So working on some really new ways to get people moving forward. And don't forget duo or sequential stim. So if you do a stim, 5 days after retrieval, you go right into the next stim. Banking eggs or embryos, which can be used as future cycles, and fresh versus frozen. Let me tell you, the answer is not straightforward. If you have an elevated estradiol over 4,000, a progesterone over 2, or you've failed fresh in the past, do a freeze-all. If you're doing any pre-implantation genetic testing, whether it's PGD, PGTA, PGS, then that's where we're doing a freeze-all cycle comes into play, by the way. All right, let me make sure I get getting all the questions asked on this for both Facebook and Instagram. Let's see, what meds do you recommend for FET? One failed FET. All right, so standard protocol for frozen embryo transfer is usually going to be estrogen and then progesterone overlap once your lining is at least 7 millimeters, and then 4 to 6 days later is a transfer. Some of the other standard meds are low-dose aspirin, a low-dose steroid, an antibiotic, either Z-Pak or doxycycline, and then adding either a PRP or HCG wash, but standard is without that, by the way. Alternatively, using letrozole and a trigger shot with a 16 to 18 millimeter follicle and aligning at least 7 millimeters, and then transferring post-trigger shot is another easy way to go. We'll occasionally do natural cycles, but timing-wise, it's sometimes a little more difficult to schedule in that. So it's not always so straightforward, by the way. All right, let me see. I'm having a little bit of a challenge is getting my my questions seen on my Facebook, but I can see it there. So I'll just stick with what's in front of me, by the way. All right, how long after laparoscopy do you guys start medicated cycles? P.S. Do they tape your eyes shut for that? Well, let's see. If you're having a laparoscopy and put under general, some anesthesiologists will tape the eyes down, by the way. They usually put a little bit of a lubricant in order not to stick to your brows or lashes, but not everyone does that. But basically we want to protect the eyes. Either some covering and putting that over is helpful. Now, usually after a hysteroscopy, laparoscopy, one or both, it's about, you can get started with the next cycle for a frozen embryo transfer. And often, if we're doing a laparoscopy, hysteroscopy, we consider that the scratch procedure, although there's some controversy in the literature whether or not it's good or bad. I don't know that absolute answer there, but I know that for sure that it's not straightforward, by the way. So anywhere between 2 and 4 weeks, you can get started with your next cycle. Sometimes we think that scratch may last for 2 to 3 months, by the way. All right, how are we doing on the Instagram? Let's see, Chang2007, we look forward to talking with you. Again, a great team of practitioners. Dr. Eric Chang joined us recently. We're working to get our Buffalo IVF open very soon. It takes time to get all the bells and whistles in place, but we're working on that. And 2020, I'm working on our Atlanta facility, but patience in the process is really, really important. If you're on metformin for only 1 month prior to IVF cycle, or do you have to be on it 2 to 3 months? It can be 2 to 4 weeks, believe it or not. Remember, keto diet, and my keto is bacon, eggs, butter, beef, and ice cream. Look at my website, drkiltz.com. Download my keto magazine. And our new family balancing magazine is coming out, and it's going to be available on the CNY Fertility website also. So 2 to 4 weeks of metformin, ovasitol, keto will really help tremendously. But if you're on 2 to 3 months, it may have more benefit in reducing inflammation in the bowels. Remember, the ovaries, uterus, tubes, the prostate, testicles are all down there, and they're all being affected by all of this, by the way. So, all right, Amanda O, how you doing? Let me see here. Let's see here. We're seeing white Honolulu. I'm not able to travel. And we can help answer any questions for. We're always glad to ship your embryos wherever you want. We work with all of your REs around the country and the world. We know sometimes it doesn't always work with us, or because of travel difficulties, or you come here to make embryos and then you want to ship them back somewhere else. We could certainly help you with that, and or eggs, egg banking and future fertility, and send them other places, by the way, I think can be really, really helpful, by the way. All right, let's see, 83 comments. Let's see if I can get to these comments on this. And but for whatever reason, my comments are being a little stubborn on my iPad down there. But all right, what do you suggest, since my last cycle only gave me 6 eggs and 2 fertilized and both of them failed? All right, so this is where you want to look at a new protocol for stimulation. Maybe it's more Menopur, or it's going to be only Menopur, or you're going to add human growth, or you're going to remove human growth. So all of these things are taken into account in making these decisions. Triggering earlier, 16 millimeters to 17 millimeters when only a few are there, and triggering with a combination of Lupron and HCG, and it might be add more HCG. Because if you're only making a few eggs, the real risk of ovarian hyperstimulation is low. I'm really, really pushing for adding at least 5,000 of HCG to the Lupron if your estrogen is under 2,000. If it's going up closer to 4,000, that's when the real risk of hyperstimulation kicks in. So if you only got a few, then you want to look at a little different ways. And if you used a high dose, you might want to look at going down on the dose and looking at a letrozole 10 plus 150 to 225, which will save some money and may stimulate even more eggs or embryos, by the way. All right. Everyone's doing well, I hope. Just a little cool down, by the way. And remember, you want to cool the body, not heat the body. Cooling the body reduces inflammation in the gut and everywhere else. Heating up the body cooks your DNA, it fries your eggs and sperm. It's not good. Sherilyn, how you doing? Myomectomy, July 18th. How long after do I start IVF fresh transfer? So fresh transfer after myomectomy, especially a laparoscopic or opening up the uterine wall enough, requires at least 3 to 4 months before doing a transfer. You could do retrievals, but you got to wait on the transfer, by the way. Let's see, Callie Swinson, how you doing? Very well, thank you. Emerose Bud, a pleasure. Should my husband needed sunshine? Well, the sunshine states, and prayers and blessings and hope and help for all of those suffering from these hurricanes, for sure. And we want to send out that love. And remember, the more we send out love to our partners and ourselves, the more amazing things grow and improve for each and every one of us, by the way. Let's see. Should my husband and I ease up on exercise? Listen, slow the Ferrari. The more you race it around, the more crazy it's going to be. And I'm telling you, racing around in the Ferrari is not going to make it cool down and be healthier. My 5 things of health and wellness: intermittent feasting, 1 meal a day. Okay, so that's important. Slow it down, cool it down. Mindfulness, remember that. And remember, lots of love. That's it. Simple. All right, hope everyone's doing well. And let me see if I'm making sure I'm getting to watching my live. And I always like to see everyone that's listening to all this. And all right, back to you guys. Let's see. Hi, doing my retrieval tomorrow in Syracuse. See you then. Hoping to do it fresh transfer. All goes well. Do I get to pick okay. These little things don't always work so easily, but do I get to pick between a 3 and a 5 day transfer? Yes, essentially you do. If you have 5 or more embryos, I recommend a day 5 or 6. If you have 3, 4 or fewer, I recommend day 3. But that's not hard and fast. But if you try to go to blast and you only have a few, there's always that small chance that you won't make embryos to freeze or transfer. That's where I say egg and sperm abnormalities, which you can't always see, they're hidden behind the scenes, may contribute to the problem, by the way, and a reason why some people don't get pregnant, even naturally, by the way. So for sure, I believe in both day 3s and day 5, 6s. That's where blasts happen, even sometimes day 7s, by the way. Hey, Janet, how you doing? Janet Rettenauer, how you doing? Can your lining be too thick for a frozen transfer? Well, don't really know that answer. I've seen 17, 18 millimeters linings and some good articles that say it's okay. So I don't think we absolutely know that answer for sure. But I think that it's something we look at. Even the baseline, you might have a baseline ultrasound of 7 millimeters and you're going to get up to 17 millimeters when you're ready. Or you might have 2 to 3 and you get up to 7 to 8. So we got to be careful. A lot of this is, we sometimes write an article from observations that don't take everything into account. So we have to be much more open, by the way. Let's see here. Fernandez, CS. Hey, Dr. Kiltz, my first round of IVF was 3-day fresh transfer but failed, but I have 2 frozen embryos, Syracuse office. what things should I do differently before I try with my last 2 embryos. All right. Let me see here, making sure I lower my sound here. I've got my crazy list, all right? We'll get rid of the top list, but basically, I got my list of everything, all right? And remember, where do we always start? Mindfulness and what you put in the mouth. You have to believe in the success. Put pictures all around of you, your partner, a family that you want to build. Start there. If you didn't do intralipids, Lovenox, Plaquenil, prednisone, Neupogen, think about those. Up the prednisone, up the Lovenox. Think about laparoscopy for endometriosis if you haven't had it. And remember, endometriosis is another indication of intra-abdominal pelvic systemic inflammation. By doing a laparoscopy, and between Dr. Luthering and myself, Dr. Ditkoff, Dr. Grossman, Dr. Verdialis in Atlanta, Dr. Faruqi in Montreal, we're all here to help bring that about. And think about it. I've seen so many people do the laparoscopy and suddenly, bingo, they get pregnant, and we're like, what the heck happened? But I thought that wasn't supposed to happen. I don't have any signs of endometriosis, no pain, no bleeding, nothing on ultrasound. Unfortunately, there's only one way you can really know, and that's to look inside with a laparoscopy. Again, it's one of those things none of us really understand, but the more I just do things that people said, oh, that doesn't work, and then I did it and it did, it's like we don't know very much as standard American doctors, right? But if what you're doing isn't working, be open to something different. So laparoscopy, hysteroscopy, full immune. Remember, the mind and the mouth matters most, and slow it down. And it's either another set of embryos or changing the environment. That's where we're at in all of this. We're working with Dr. Vidali, reproductive immunology, worked with Dr. Braverman for years. Another great laparoscopist, by the way, looking at endometriosis. And don't forget Dr. Kondrup down in south of Sarasota in Venice, an excellent laparoscopist. But talk to your gynecologist, your OBGYN doctors. Ask them the question, hey, I haven't looked at this. I've been doing all these IUIs. I'm thinking about IVF. But before I go that, might I benefit from a laparoscopy? Oh, I don't want to do IVF. I want to try something more natural. Well, okay, laparoscopy is not natural, but neither is driving a car, by the way. Listen, I know this is going to be a little weird. I just want to clean the camera here. Sometimes by just cleaning the camera a little bit, it just suddenly, bingo, I look more clear. All right. Everyone doing okay, right? He's a little crazy, I know, but I'm sharing some thoughts and ideas that I've learned for so long and I didn't believe. I'm talking next week at the Canadian Fertility Meeting in Ottawa. I'm really excited. I'm going to talk about integration of Eastern and Western medicine. I think it's for healthcare practitioners. I'm looking forward to another American Fertility Expo, but I'm more than willing to continue to share this conversation with everyone and anyone out there, by the way. Hey, Bessie, how you doing? Metformin before transfer. 500 milligrams of metformin may be adequate along with olvasitol and keto. And remember, if you're vegan or vegetarian, you can still do keto. I know I'm mostly carnivore keto, but there's plenty of Mediterranean ketos or vegan vegetarian ketos, and if you're pescatarian, whatever it is. Much of what I believe is reduce the frequency, the amount, and the variety of what you put in the mouth, and do it at night in order to rest and digest and get off the treadmill. All right. So Tiffany Marilee, I hope I helped in that. Let's see. Oh, I'm sorry. Tiffany Marilee, Marie IEE. Is it possible to do a fresh transfer and freeze the rest on cycle day 3? I do a lot of day 3 transfers, a lot of day 3 freeze-alls. You can always thaw the day 3s and take them to blast later. You can always decide, hey, I want to thaw them, blast them, biopsy them later. They work really well. And listen, If you want to do a blast or PGS testing, you have to say, hey, I want to do this. And we I know, need to be more diligent about check off the boxes, sign what you want. And if you want to do PGD-TS testing of your embryo, that takes an extra step to Cooper Genomics. It's a little more costly. You got to tell us. It's not the same as genetic screening of the sperm source or the egg source. It's the embryo. It's not perfect either. And I know I've talked about the soccer ball. If we biopsy some other area, we may get a different answer. And I've always said, had my mother had me tested before I got in her womb, they might have thrown me out. We see a lot of people with abnormal embryos that decide to transfer them, and we get some normal babies out of that. So that's pretty amazing, by the way. CBD THC free and got very sick. Then don't do it, by the way. Sometimes some people are allergic to things or get sick. Remember, these are all plant-based materials that still have some phytochemicals that some people don't tolerate. And don't do vaping. We have taken our vaping equipment off of our shelves. We're going to stop selling it both in-house and out-of-house. We'll take the loss on it because everything I can see, it's not good for any of us, by the way. Fresh air. Remember, mindfulness and meditation is breath and smile. And bring in cognitive positive thinking to your daily life, by the way. And all right, let's see. Can you please speak about those with chromosomal translocations? Okay. Balanced and unbalanced translocations that may be found in the egg source and the sperm source, which may contribute to abnormal embryos, which may contribute to an increased risk of failed implantation, infertility, or repetitive miscarriages, whether they're biochemical or they're chemical seen on ultrasound. You know you have a clinical pregnancy. Now, I think this is all part of the same thing. If all the inflammation is going on in your body, it may enhance the abnormalities or increase the risk of having those and cause miscarriage. So PGSTA testing may help identify those embryos that do not have the unbalanced translocation and may be helpful if you're having repetitive failed IUI or natural cycles. That may be reasonable. That said, that's why I often recommend karyotyping of the sperm and the egg source for everyone. Unfortunately, it's not something we throw into the mix of testing for everyone early on for cost reasons, but really everyone that's infertile should have male chromosomal and genetic screening, female chromosomal and genetic screening, do some sort of reproductive, do some sort of metabolic, inflammatory, immunologic, and hematologic evaluation for everyone. Sperm count, hormone levels, testosterone, look at TSH, FSH, LH, and prolactins, if I didn't mention that. And on the female side, AMH, along with those hormones, I think are important. And don't forget, there's so many people that are pre-diabetic. Look at your fasting glucose levels. Look at your hemoglobin A1C. But as you know, most of us don't have the signs or symptoms of pre-diabetes or metabolic syndrome until it's too late, unfortunately. Can lining be too thick for frozen? Rayanne Rettenauer, how you doing? As I mentioned, it could be, but mostly I'm looking at the 16, 17, and 18 millimeters. We've had some success on that. Getting pregnant, doing the first round of IUI, doing nothing wrong with me. 2 years of no luck, arcuate uterus, that's all. Mrs. Dosham, how you doing? So in general, open tubes, regular cycles, normal sperm, IUI increases your odds from about 1 to 5% to about 5 to 10% with Clomid or Letrozole. Injectables may increase them up to 15 to 20%, and IVF between 30 and 40% if you're under 40 years of age. So that's the first, second, and third cycles. After maybe 3 or 4 cycles, the odds are going to begin to flatten out, but they don't suddenly stop and don't go up. Keeping at it. remember, a positive mindset, a persistent mindset. And you gotta, we have a lot of negativity going on in our minds. And I think ultimately we just fall back to that. And we have to learn to get to another step and get away from that, by the way. So certainly I think it increases. Natalie Freeman, how you doing? Let's see, Mrs. Carmen Romero, what meds do I need prior to my ERA? All right. So the endometrial receptivity assay, or the ERA, is an endometrial biopsy on the 6th day of progesterone in a medicated cycle in general. It can be done after a trigger shot and a natural, but it's really meant for medicated frozen embryo transfers. And the timing is, okay, so I do a trigger shot, I'm going to do my biopsy. It's going to tell me if I'm in sync, the timing wise. So really, you don't need much in the way of medications, but in general, we use estrogen and progesterone. Now, if you're using a ton of other medications, then the question is, should you be on all of those at the same time in a mock cycle? They're costly, they're a lot of intervention, and not always, and I don't know that we really know that answer, since a lot of people are still pulling their hair out. Does everyone need an ERA? Well, you know, should everyone do everything? Again, back to the list. Should we do everything prior to doing your first fertility treatment? And that's the million-dollar question. No one has the real answer to that. PNW, let's see, Florin, it's Naomi, have you years of InvoCell? If so, any success for women over 40? InvoCell is nice, we use it. It was mostly developed for cost reduction, but our cost is already lower than InvoCell anyway. I don't really see a benefit over standard IVF other than, hey, I want my egg and sperm in this little vessel in my vagina, although we've seen it where it falls out and it's not perfect, but we're open and we do have it accessible if anyone wants to use it. So let's see, what's your Williamsville office phone number? Let's see. So if you simply go on to the CNY Fertility website, we'll get you directly through our central location to get you into our Buffalo, Williamsville office. Chris Ziegler, she's back, and our team is amazing. My Rochester and Syracuse team went out and helped. Really grateful to everyone there and glad to have Chris back, by the way. And Dr. Eric Chang is joining us soon there. We got to get our New York State licensed people to get his medical license in New York State going. But he's right now doing phones from New Jersey and here to help answer questions and get everyone moving forward. All right, let's see. Ursula Wildman, how you doing? Is it possible to get pregnant with an AMH of 0.3? Yes, it is. Remember, these numbers are just indications of factors going on in your body that may reduce or improve your odds. But in fact, it doesn't tell us whether you will or won't. And I've seen the combination of keto, DHEA, LDN, with or without CBD, mindfulness, meditation, focus, and belief. And remember, slow it down, cool it down. Water, remember, alcohol damages eggs, sperm, embryos in our bodies. Get rid of it completely. I've seen improvements in AMHs, and even without the AMH improvement, I've seen pregnancies. And don't forget the mini protocols, lower cost, of just getting lower cost, lower meds, lower stem, a fresh cycle. You may or may not have embryos to freeze, but it's probably one of the most affordable things you can do. And I've seen people with a 10 letrozole 150 of gonal or follistim or Menopur make 10 to 15 eggs and do really well. So, hey, my meds are too costly. And between Metro and Integrity, we're really grateful to all of them for helping, by the way. Let's see, after doing my myomectomy surgery, we're here to answer that. How's everyone doing? All right. just a moment of a breath and relaxation. Let me cool it down a moment. All right. Chrissy Bird, and keep, let's see, September, October, November, December. We're coming up on January quickly, but if you need to get in sooner, keep throwing it out there. We're helping people all over the place. But how do you improve your chances before your consultation? Well, that's where all of this comes in. And don't forget the CMI Fertility website, the Dr. Kiltz website, Dr. Robert Kiltz, Dr. R. Kiltz, Dr. Kiltz, the Mind, Body, Smile website, or the CMI Healing Arts. Oh, don't forget Miss Maria. Maria Emmerich's got some amazing stuff. And keto is kick-ass amazing. And again, whether you're a vegan or vegetarian, a standard eater, a paleo, or you're somehow on Kiltz's keto, you will find that you feel better, your energy's better. You don't have to work out and do exercise. You feel it every day. It's a crazy, amazing one. And one of my favorite authors that has really instilled this concept idea, Gary Taubes. And it really is amazing. And the audio version is fantastic. I find so much helpful, amazing information. And one of my crazy books too is, and it's a little crazy, by the way, but I know this stuff is backwards. I'm sorry about that, by the way, but so Maria Emmerich, Gary Taubes, and these are all on my website. And this one is from Kent Risky, Absolute Truth Exposed. Crazy ideas, but for whatever reason, sometimes crazy ideas are really open up. And the one thing I've learned through mindfulness and a meditative and a positive approach to life, it improves for all of us. Egg prep for 50-year-old, never had infertility issues. Can I use my own eggs? Absolutely you can. And doing everything we talk about and having faith and belief. But remember, donor eggs and embryos, sperm and eggs are always available. And don't forget, all right? If what you're doing isn't working, be open to something else. And if you have extra eggs or sperm or embryos, donate them. Like, there's so many people in need. Just ask people out there on the CNY Fertile Facebook support groups, the private or open. The more we share, and even if you say, hey, I love carrying a baby, can I help someone by carrying their baby with little or no monetary remuneration? Why not? Because we're here to be helpful to others without the need to get back. I've been watching the Kindness Diaries. It's really great little diary on Netflix, and always looking for some ideas and inspiration. That's what we all need. Slightly elevated prolactin levels affect IVF. How long can it take meds to start working to bring those levels down? Hey, Vicky. Often the slightly elevated prolactin levels don't matter, but that's where Dostanex or bromocriptine may help. In my opinion, it's the same thing. It may be related to PCOS, metabolic syndrome. We often see a slight elevated level. Keto, anti-inflammation, acupuncture, massage, light therapy. These are all the things that are going to help on the journey, by the way, and it'll help bring those levels down for sure and slow it down. Subchorionic hematomas, Laura Elizabeth. That's a very good one. Let's see if I can try to bring this into place, by the way. But let's see how good I am in this. But basically, here's the. Let's see here. Here's the uterus. Here's the placenta, and here's the embryo. Sometimes there's inflammation of the blood connection to the placenta and the uterus. When that separation occurs, you'll get bleeding into an area which fills it like a bruise. It's a hematoma. I believe it's caused by inflammation that gets into the uterus, that damages the blood vessels feeding the placenta. It cuts off the oxygen and blood supply to the placenta and causes the separation. That's why we do a lot of anti-inflammatories like Lovenox and aspirin, Plaquenil, prednisone, intralipids, and the likes. So the subchorionic hematoma is an indication of an abnormality that happened that caused that. And then that separation sometimes can go on longer, cause more separation, more reduction in oxygen and the nutrients to the fetus, and cuts off the blood supply and ultimately causes a miscarriage. Many of these resolve naturally, and that's why I really recommend, if you do keto, paleo, stay on it once you're pregnant. Remember, the more you eat fruits, fiber, and vegetables, as they recommend, 6 meals a day, which is ridiculous, and count the carbs, you're causing more inflammation in your bodies. It's fat, it's intralipids, it's Plaquenil, Prograf, IVIG, Humira possibly, also that add to reducing inflammation. So that's why I think it's really important. So again, if there's inflammation that's flowing into the placenta, it's going to cause a vasculitis. That vasculitis causes blood clots in the blood vessels that basically cut off the blood supply, and it separates and dies. Hey, Brittany, how you doing, by the way? And I got to tell you, this is a hard business, by the way, for everyone. There's a lot of things going back and forth that we feel unsupported, and it's never any of our intentions to be unsupportive. And remember, we're all human beings working on this crazy journey to do better. And I got to tell you, we have an amazing team out there that's working 24/7. We're working on better phones, better texting. Communicate through your portal. It's really great. I'm working on ways that if we get your blood work today, we might not have an answer for you tomorrow. Continue what you're doing today for tomorrow as we're working to make it more efficient and to help you on this journey. If you need a baseline ultrasound and blood work, go ahead, let's get them. Let's get you started on your meds. Let's make it easier in all ways, by the way. Third and final transfer will be in October. I have 2 embryos left, 3 cc, and we are transferring both of them together. Good plan, Dr. Ditkoff. We aren't doing PRP because I have had really good lining. PRP may help with implantation, not only improving what the lining looks like, by the way. So that's why I talk about it. Lovenox, Plaquenil, prednisone, Neupogen, HCG boosters, and remember, keto. And embryo glue, we offered, you got to ask for it. We got to ask for it at the time we set up your cycle, because it's not always easy to get to the embryologist. And those embryologists are working to work on your egg, sperm, and embryos. We have so many questions coming their way. It sometimes takes a day or 2 to get them answered, unfortunately. But do you recommend embryo glue and HCG wash? I recommend them all. And again, it's back to what should we not do, and why should we not do one thing over another, by the way. Let's see. Natalie, how many embryos can I get out of 6 fresh donated eggs? Well, you may get 1 embryo, you might get 6 embryos. This is the challenge. Every egg and every sperm comes from a human being. We don't know about that egg or sperm until it gets to do its work. And so this is the challenge with donor eggs, donor sperm, donor embryos, by the way. Let's see, medicated isn't working. So we talked about the different medicated, natural cycle frozen, letrozole or Clomid cycles, adding letrozole to estrogen, progesterone, even gonadotropin cycles sometimes can be helpful in that also. Using a gestational carrier in New York is legal, by the way. It's not illegal. The compensation, the contracts have some questions, may not be upheld, but people do it all the time, by the way. Let's see. IV Moralest. Let's see. I have endometriosis stage 3 and had it removed a couple of weeks ago. My left tube was clipped. I still have my right tube. Could I try to get pregnant naturally, or is it IVF my only option? If you have an open tube, keep practicing the natural approach, by the way. And don't forget all the stuff we talk about. Slow it down. Believe in the power of that which you desire as if it is already coming and it will be that or better. And don't forget mindfulness, faith and belief in the higher power within all of us. And so I've seen people who do the endo clean out, clip a tube, and then suddenly they're pregnant because they have another normal tube. I really highly recommend removing as many as you can if they're abnormal, because that reduces the spot of inflammation like an abscess. Keto. And 1 to 3 months of Orilissa plus Letrozole 5 or Lupron 3.75 for 1 to 3 months plus Letrozole. Another protocol we've learned a little bit more about in helping to enhance implantation, which may help either natural IUI or IVF. We have to be open to these things for everyone in all ways that they're trying, by the way. Someone about adding the immune protocol before I order my meds this month. How do I go about that? Talk to the nursing team and say, listen, I want to do as much as we can. The nurse often could come directly to the provider and ask the question. It's sometimes faster for that nurse to talk, hey, I want to add these things, rather than trying to get an appointment with one of the providers, which sometimes takes a little longer. You know, I automatically recommend the Works, the global, the blanket approach for everyone. I think that's really helpful, by the way. And don't forget, share the likes and the loves. Press the button at the top of the bottom, wherever it's at. The more we share it, the more we're doing an encompassing global approach to health and wellness. Whether you're doing this for fertility or you're trying to get rid of all those crazy diseases that are caused by modern medicine's recommendations of a healthy diet and lifestyle. I'm sorry, it's craziness, by the way. All right, let's see here. Making sure I'm getting. What can we do to improve our chances? And remember, keep watching, keep sharing, keep moving forward. Don't let go. Maybe in a couple of weeks, we'll have the fire back on. As it's beginning to cool down here, by the way. And let's see here. What caused embryos not to progress from day 3 to day 5? Okay, this is not usual if you have 14 embryos. But that said, it's either a bad sperm, bad egg, bad embryo, or bad environment. And even the culture environment is not always perfect for every single sperm, egg, and embryo. We know that. And so either it was contaminated with something from the ovary, the vagina, the sperm, or somewhere else, or that sperm or egg was not competent enough to get to that level, which may explain why some people don't get pregnant. That said, it may be tweaking the protocol or saying freeze on day 3, because the culture conditions are not perfect for everyone's egg, sperm, and embryos. We just know that. Because if it were, everyone would be having a better outcome than we're seeing. This is a really hard, challenging process. Let's see. Trying to do a fresh transfer after retrieval. Tiffany Marie, it's about 7 days. So retrieval on Monday. You can do a transfer on day 3 on Thursday or 5 on Saturday. So that's approximate. You usually, if you're going to do Monday retrieval, show up on Sunday, and you can leave on the day of the transfer, by the way. Letrozole, only one Andrea. How you doing? We do a lot of Letrozole trigger shots for under 35. We do a lot of Letrozole 5 to 10. Usually 5 plus a 150 of gonadotropins for those over 35 for the IUIs. But we also sometimes will combine those for the IVF cycles. Tiffany Marie, live in California, will be doing the bulk of monitoring here. We're really working with your OBGYNs, radiologists. We see people around the country and the world. Again, we're offering financing. We may be adding a little bit of a down payment to help us on our processing and helping people. And the more people understand that if we offer a payment plan, please meet your payments. That helps us help more people. And we're here to be helpful for everyone. Let's encourage everyone to be on spot with all of that, because we want to continue to make it affordable, accessible for everyone out there, by the way. Let's see. Oh, SK Hill. No problems getting pregnant, but I lose the baby every time around 6 weeks. Lost 8 so far. Is IVF my only option? All right. Keto, 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 kick ass, amazing. Reduces miscarriages, reduces inflammation. It helps for so many. Don't forget intralipids, Lovenox, aspirin, Plaquenil, Prograf, Neupogen. Now people are saying, no, wait a minute, I don't have a diagnosis. Why are you doing all of that? Believe me, so many people spend so much on IVF without any diagnosis other than nothing else worked, and they don't have something that says I need IVF other than that other stuff failed. Trust me. When what you're doing isn't working, be open. Now, you might start simple and easy, but absolutely, IUI and IVF will help with or without PGS testing. And don't forget, immune protocols. And if you go to my website and look at my family building guide, you'll see a lot of conversation about that list there. By the way, fermentation in the GI tract from eating a tremendous amount of carbs makes alcohol, aldehydes, methane gas, and heat, which causes a tremendous amount of damage to the egg, sperm, embryos, uterus, and everything. I bet it causes colon cancer, breast cancer, skin cancer, every disease we have. It's a hard one to believe, but I will bet $1 billion that I'm right. Lovely Chas, Lovenox or low-dose aspirin or both, even low-dose steroids. But remember, you got to watch it. We will go often to 12 weeks, wean off after that, but some people require it 28 to 36 weeks. If you have a lupus anticoagulant, it's more solidly scientifically based. But remember, a lot of scientific studies are just our perceptual opinions based on a research project that we wanted to get published, and someone allowed us to publish it. And often it's not so scientifically right. It's a lot of perception and bias. And if you really recognize the truth about modern medicine, it's not such an exact science, by the way. Can IUI and FET be done in the same cycle? Just 5579, yes. And for some reason, it might be intercourse IUI may help reduce inflammation in the uterine and the pelvic environment. And we do a lot of PRP, intrauterine and intraovarian, intraperitoneal. And don't forget, the hysterosalpingogram with oil contrast reduces inflammation and may help, along with antibiotics for 2 to 4 weeks, may help reduce inflammation in the gut. And probiotics are not good for us. I'm sorry. Let's see. Testing and monitoring in Atlanta. We're working on sperm freezing, IUIs in Atlanta. Dr. V and others will be doing laparoscopy, hysteroscopies. We're working on that coming. And let's just keep the focus. IVF to Atlanta 2020 as we're working on all others, by the way. And with our good friend, Dr. Paul Magarelli, down in Colorado Springs. We're really, really a good guy and helping doing some monitoring, and really grateful to him, by the way. And your OBGYNs, your REs, wherever you're at, we are grateful for their assistance in this, in helping you and open up to different new and different ideas. And don't forget, light therapy, massage, herbs, meditation, prayer, spirituality, and slow it down, by the way, right? And listen, remember, CBD oil is a plant phytochemical that not everyone tolerates. And THC and medical marijuana, whether you're vaping it, however you're getting it, and alcohol is bad for us, all right? And so we want to work to utilize cleaning the mind and what goes in the mind and the mouth And remember, intermittent feasting, which is fasting and eating only one meal a day, in my opinion, it's at night. A little bit of snacking here and there, but you want to narrow the window, narrow the variety, narrow the volume. It's not good for us. How's everyone doing? HCG, let's see. Would you recommend frozen for a 42 female with 42 female with PCOS? PCOS may have a little bit more support in a freeze-all cycle, by the way. But remember, we're only giving advice and not saying you can or can't do an embryo transfer. We might say it in a way, but we want to give you the best advice. Ultimately, you can do a fresh transfer or freeze-all. It's your decision. But if you're doing PGS, we only do it with a freeze-all cycle, by the way. Remember, you can always take frozen day 3s or frozen day 5 or 6s and thaw them and carry them to blast and biopsy them and refreeze them, by the way. Mrs. Romano, Carmen, yes, FET failed cycles can be due to immune issues. The problem is our ability to identify it. If you're a live human being, we all have some immune issues, by the way. Exactly what it is and why it is, that's the mystery of the universe that I can't adequately answer the questions. But I can tell you this, we all have it. It's caused by our thinking, negativity, by the way, which has an electromolecular reaction in our bodies, and that's why prayer meditation is so powerful. Find some artistic endeavor, whether it's painting or pottery or poetry or music, but then remember, the more you put variety and frequency and fruits, fiber, vegetables, and probiotics, it's going to cause havoc in here and inflammation. So look at our stuff on the immune system. Winner for the Rainbow Baby IVF giveaway. Will, thanks Will, thanks Jake, thanks Aaron, and my whole team. I'm really, really, really grateful to everyone for all the help that they're doing out there and supporting the CNY fertility team. But I think he's going to give that answer out there. And remember, we're here to help everyone. HCG boosters. I think HCG boosters can be helpful, but you got to be. It's 250 units a day, and don't forget, guys. 250 units a day of HCG, 25 of Clomid, keto. And if you're on testosterone supplementation, you have to add the HCG, and you can still take it, by the way. Everyone's doing well, I hope. Thanks for staying with me, by the way. And I'm contemplating Monday night instead of Sunday night, and maybe I'll mix it up a little bit to shift it up because a little variety is good. Too much variety is not so good. And I hope everyone, again, is doing wonderful in this whole process, by the way. Let's see here. Where are we going? All right. Does low progesterone play a role in infertility? If so, how can I improve low progesterones? Clomid, letrozole, gonadotropins stimulates ovulation, trigger shot improves it. The other is to add progesterone. But I think if you enhance ovulation, and that's where letrozole, Clomid, gonadotropins, and don't forget ovasitol, metformin, and keto really helps because a lot of those with metabolic syndrome, PCOS, have bad ovulation. Iron is pretty low, and I'm anemic. And don't forget, low iron, low vitamin D's are detrimental to your fertility. So that's where you got to add the vitamin D, you got to add the iron. And if you're a meat eater, get to the liver, by the way. But if you're not, then you want to look at other supplements to make sure you're getting it, by the way. West Coast options for fertility center, absolutely. But we want to do this in the most quality way possible. We're going slow and easy. We're looking for really a whole host of people that want to help grow this in a way that is a positive, and now we're going too crazy, but absolutely. And again, from all over the world and the globe, and I'm working with some friends in other locations, and that's where Dr. V came in. That's where Dr. Faruqi came in Montreal, and Dr. Nagarelli in Colorado. But if you have a doc, OB/GYN doc, wherever you're at, that wants to help do monitoring, to help bring this about, help enhance this, we want to talk and be part of the team, by the way. Eelalli, Eelalli, and again, sorry about my mispronunciation of any words or anything. And Texas, shout out, awesome and amazing. And we're sending prayers to everyone who's going on this journey of suffering because it is hard. That said is, we want to all dig together to show love and kindness and generosity and gratitude each and every day in every way we can, by the way. All right, do you decide on transfer 2 embryos? 1 is best. Over 35 open to 2-day 2s, but PGS normal 1. And we're holding it down because we have a lot of pressure from outside forces. Plus, we want to give you the very, 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 very best care, by the way. So, we look forward to seeing everyone, by the way. Let's see. Recommend for FET. What cycle days? All right. Cycle days. Remember, we transfer frozen day 3s on day 4 of progesterone in a medicated cycle, and typically you're gonna freeze, you're gonna thaw and transfer based on when you triggered. It's a little harder, but it can be done with a natural LH surge. But we want to confirm ovulation with either a blood test or urine testing or ultrasound. By the way, hello Texas. Miss Sophia, back to school. Amani down in Costa Mesa, Newport Beach. So much gratitude to everyone out there, by the way. And I know sometimes I seem like I'm all over the place. ADHD, hyperactivity, attention deficit, as they say. But I'm really on point to do my very best to learn, to share, to grow with everyone. Your words, your critiquing. And remember, we're here as human beings. We all do better to words and ideas that are more loving and kind, all of us. We are on that journey together with you. But we do know it can be frustrating and challenging and elicit things that are hard. Vitex. Sure, you can take Vitex, by the way. It may help. This is where I think letrozole comes in. Reducing estrogen levels can be very helpful. Cheryl Dilly, hello to you. Jackie, hello. Transfer Wednesday, day 5. A pleasure. Looking forward to seeing everyone. And grateful. Share your stories of positivity, of success. The more we share that, the more we learn, each and every one of us. The more we learn, the more amazing. Oh my God, wow. By the way, making sure I'm getting everyone. We're closing down in just a little bit. AMH3, FSH 16, first IVF, full stem, 1 egg. Didn't fertilize, second cycle, mini added omnitrope, got 2 blasts. Keep going, by the way. Listen, I don't know when it works or how it works. I don't know the number that you and I will have that I'll say, oh my God, that's a slam dunk, or it'll never happen. I've learned this in life. None of us know tomorrow. Remember, the morrow will worry about itself. We have to have faith and hope and hold that positivity in every way we can every single day. So, God bless to my Facebook, Instagram, but share with everyone out there. And my pleasure always. See you next Sunday. Maybe I'll throw in a Monday, who knows, and switch it up a little bit. God bless. Dr. Rob Kiltz. I'll see you then.